First of all, congratulations are in order, Dr. Ndume. As
Yeah.
influence per excellence, what do you make of this list?
Oh, yeah. The list, I think it applies to people whose work has a positive impact on individuals and communities. People in this selection have shattered glasses and do so with great bravery, determination, and personal sacrifice. Others are shining examples of what can be achieved, no matter the odds stacked against them, both in Africa and the diaspora, if the dream is real enough and the drive is powerful enough. I think that's what I think of the list.
Right.
But, yeah. Mm-hmm.
All right. Now, New Africa magazine 2017 also listed you, and now you're listed again. What keeps you going, doctor?
Uh, what keeps me going is that when we get out there, the energy, when we get out there, especially when we go to our villages and the community, you can see the need is so great. And it will give you sleepless nights if you don't do what you can in your little way. And that keeps me going. And especially when they regain their vision, no money can pay that. The happiness, it changed their lives completely. And they can go and contribute in their little community. And it makes them also to be independent from other people, from the relatives who are also having their busy lives, especially the young people of today. So it's very important. And we also have to know that most of our old people, especially during the pandemic, HIV pandemic, which was when before medication came, many old people were left to mend for their grandchildren. And that if they also go blind and they can't have the little ones, it becomes very devastating. So these things are things that are driving us to go and give back to the poor communities.
Right. Now, ophthalmology is a field that basically not many will dare take on. But what inspired you to major in this field?
I think ophthalmology as a medical it's a medical specialty in the care of diseases. Anyone can study it, honestly speaking, if they are interested in the field. And now, for example, in Namibia, we have many ophthalmologists, and the number of ophthalmologists are increasing. And I'm also happy to say that a number of people are joining this specialty. So that is one of the things that makes me really happy, that young ladies are coming up now. As we are speaking now, there are 3 of them who are currently in South Africa specializing in ophthalmology, and that makes me very, very happy. So everyone can really do ophthalmology if you are interested in. And I was interested in ophthalmology, and I also was motivated, whatever, by people like Dr. Lizetina, who say you must go and do ophthalmology. There is a lot of blindness in this country.
All right. Now, doctor, they call you Ongangayo Meho, which basically means the eye doctor. And you've restored and you've had sight restoring surgeries of about 35,000 Namibians, which was basically free of charge. And this is actually not cheap surgery. Why did you do this?
It's not cheap surgery. As I told you, that it is changing people's lives. And many people, if we leave them without the operation just because they don't have money, which many of them really don't have, if you go into the community, they don't even have transport to bring them to the hospital so that they can be taken care of in them if they have other diseases. So you have to give it to them free of charge. And for them, it is free of charge, but it is not free. It is also not free because it is a lot of funding involved from government, NGO, personal sacrifices of the doctors and the nurses and everyone who is taking part in this noble cause. So it's exactly what like I said before. the community, the changes that we are bringing into the community drives us always to go and help people and do whatever we can to take care of everyone and to take care of everyone by seeking for help from different NGOs to also meet our government halfway.
All right. Now, Doctor, just shortly before we let you go, in your opinion, how important is it for one to take care of their eyes? And also, has the healthcare system prioritized ophthalmology?
Yeah, it is very important for us to take care of our eyes, and that's why at least in ophthalmology we have created eye clinics all over the regions where we have a clinical ophthalmic officer taking care of these patients in the communities. And then I think the Ministry of Health has really prioritized also ophthalmology, the care of eyes, because at least they have seen the changes it brings to the community. I mean, it's not only helping how can I put it? If you have people all over the region in the villages who are blind sitting at home, it affects the government terribly.
Right.
First of all, it is affecting the young people, the young children who cannot go. Maybe also they will just say, no, today you are not going to school because you have to take care of grandmother who cannot see. So it affects everyone in a negative way. And that's why the government has also recognized the importance of ophthalmology. I mean, not only ophthalmology. I think all other departments, they are all important in their own way. Cardiology, orthopedics, whatever. They are all important in their own way, and the government recognizes all of them. But it's for us to also meet the government halfway by going on our own to look for help from other NGOs and individuals to come and help and meet the government halfway.
All right. Yeah. Doctor, thank you so much for joining us this morning. We appreciate all the work that you do for the Namibian nation, and also we wish you all the best with your future endeavors, and congratulations.
Thank you so much. I also want to take time to congratulate my other two colleagues, the First Lady and our Miss Hausiku, for making it to the list of the 100 influential people in Africa and the diaspora.
All right.
Thank you so much.
Thank you so much,
Bye-bye.
Doctor.
You're most welcome. Bye-bye.
That was Dr. Helena Ndume talking to us there. She is listed as one of the most 100 influential people in Africa, and she's basically talking to us about her journey and also how she helps out and how she likes to be part of, the ophthalmology department. And she is the head of the department in the Windhoek Central Hospital.